Week number 2, lecture number 5. Hello friends. Now we will be talking about communication between healthcare professionals. We have been talking about communication, general communication, and in this particular week we discussed about active listening and active listening skills. Communication between healthcare professionals is also very important. Of course, I am talking about healthcare professionals, that is the doctors, nurses, and at lower level comes the health workers and others. Most of the points are applicable in our hierarchy also, like in a family, parents and children. Parents are at superior level and children are at lower level. Similarly, at work level also. So, those application can be made at any level where hierarchy is being implemented in its own way, organizational hierarchy, family hierarchy, and in health departments they have got a medical hierarchy, doctors at the top, at middle level we have got the nurses, nursing staff, and lower level we have got different types of healthcare workers. Purpose to review the importance of excellent communication among healthcare providers in promoting career satisfaction. This is the important point. As a human being, anywhere at any stage of life, you have to communicate. I mean, so it is necessary to communicate. When you go for shopping, again you have to speak to the shop owner, this is what I want. You go to a vegetable vendor, again you just say, this is the vegetable I want. You go to a doctor, again you just say, this is what I am suffering from, I need some medication. Communication is an essential part, and if you can communicate properly and you can convey what you want to another party, you get a sort of satisfaction. As parents, you can communicate to your children what is good grooming, what should you do as a good citizen, how should you get educated properly. You are a successful parents and you get satisfied. So, career satisfaction as a doctor, as a nurse is very important in our life. Similarly, patient safety. When a patient comes to the hospital, and when particularly in our Indian society where we put doctors next to God, we are in safe hands. And therefore, doctors must understand that the patient's safety in their hands, and patient safety comes through excellent, proper, effective communication. Brighten the image of health professionals. If you are good at speaking, if you listen to the patients properly, it is words mouth, that is how you speak. You generally doctors, most of the doctors, they do not go for advertising agencies. Of course, nowadays some corporate hospitals do advertise for themselves, but otherwise normally doctors do not go out. It is just words of mouth from one patient to another patient. If you treat a particular patient very well, nicely, and he gets cured, he goes out to his village, to his society, and he says, yes, Dr. so and so at so and so place, he is like a god. He listens to you properly, he gives you proper medication, he does not overcharge you, he does not get angry with you. This is how your image gets brightened, and automatically your name in the list of health professionals comes at the top. So, this is the purpose of this particular lecture. Objective: contribution of good patients, of communication in safe patients care. Patients care is basically, it is a communication between the patient to the nurse, and from nurse to the doctor, and sometimes from the relatives of the patient to the doctors, and likewise, it's interconnected communication. If it is a good communication, then patients remain in safe hands. Concisely summarize. Doctors do not have much time with them, they have to look after so many patients. So, you should be able to convey what you want to be done in your physiological condition. You should be able to summarize. Active listening, we have spoken in last 2 lectures, it is very important. Without active listening, no messages can be passed. A message is passed provided the receiver receives it properly, understands it, and then implements it. And here in this lecture we are talking about assertiveness also, because at times educationally, medically, professionally, doctors, nurses, they are at higher level because they have studied medical science, and we people as layperson, we haven't studied, patients haven't studied it. So sometimes certain things they want to convey may not like it, may not believe it. So some sort of assertiveness is required in medical profession. We take firstly nurse and physician communication. It's a frequent occurrence. Normally a patient meets a doctor once or twice in a day, or sometimes once in a day, or sometimes maybe once in a week also. However, the nurse remains with the patient all throughout, and what is happening, what is the outcome of the medication, that is being frequently told to the doctor, and that occurrence happens many times in a day. Communication across a hierarchy can be intimidating. Sometimes a nurse also feels that they are at lower level, they do not pass the proper information to the doctors, they are afraid of them. Gender or cultural issues in our society, yes, ladies, gents, all these barriers are there. In proper communication, we need to eliminate those barriers for safe communication and for the safety of patients. And this happens to be the nurse job dissatisfaction, because she cannot communicate properly, and in the bargain she gets lots of rebukes from her boss, and she doesn't like the profession. She just chucks the job, she quits the job. However, this is critical for patient safety, because as I said earlier, nurse remains with the patient all throughout, 24/7 and 24 hours in a single day. Therefore, he or she, nurse can be anybody, any gender, sees the patient, oversees the patient, looks after the patient, and therefore the nurse communication with the patient as well as with the physician is very, very critical for patient safety and recovery. Remember this, most of the medical errors are caused by mistakes in personal communication, because the messages are not conveyed properly. When I say medical communication, it is the prescription also. Prescription is a sort of written medical communication. Why prescription is important? Because as per that medication, dosage needs to be given to the patient. Until and unless that dosage goes inside the body of the patient, that recovery cannot take place. And if there is some error somewhere in wrong prescription, or dosage is wrongly given, overdosage has been given, it creates medical error. And my dear friends, it leads you to medico-legal problems. Medical-legal issues. Poor coordination between all the people in medical hierarchy, starting from doctor to the patient and the relative, is triggering adverse events, and that includes medico-legal cases also. So, to avoid this particular situation, you need proper communication between health professionals and patient and the relatives. Now, here I just give you 4 steps to excellent healthcare communications. It's applicable to all. I told you in the beginning of this lecture, this particular lecture and the points are applicable anywhere at any stage, wherever hierarchy is functioning. Like in family, hierarchy is there. At work level, there is a hierarchy. In school, there is a hierarchy. In government, there is a hierarchy. And of course, here we are talking about medical hierarchy. First step, clarify the problem and gather data. Then it goes up. So, the first step is basically collection part of it, collection of data related to what? Disease, the condition of the patient. Second, concisely describe the problem. Now, this data to be put concisely and to be transferred to the higher people, to the relevant people. This transfer of this concise data about the condition of the patient needs to be done. Once you transfer, active listening and the response, what action needs to be taken, and finally assertive concerns if needed. This is very important. Normally doctors and professionals should not be assertive with the patient. They should be always calm, gentle, polite. But when patient doesn't agree and a doctor feels that this will go against his recovery, against his life, he may not be able to live longer because of the disease, then sometimes very mildly he becomes assertive, and then he just says, yes, if you don't do this, then this might happen, It is in your hand, choice is yours. So, sometimes assertive concern is required by healthcare professionals. Step 1, gather and clarify all of the information you need to provide to the physician. What all information you require, either from patient side, from nurse's side, which needs to be given to the physician. Step 1, nature of the problem, what is happening to you, symptoms, supporting information or data. Supporting information, when did this problem start? Did you visit some another doctor previously? What has he given? The total medical history. Medical history is very important. Therefore, patients, most of the patients, you must have seen, they have big file, because that contains medical history from the very beginning, when the disease, when the symptoms started, when the patient visited the doctor and diagnosis took place. Clarify in your mind what you would like for the patient to do, for the patient what you will do. This is a case presentation, just for your understanding only. You are assigned to a care for a 60-year-old lady for the evening shift. She is 2 days post-operative following hip fracture surgery. No problems were noted at nursing sign out other than care of pain, for which she was receiving pain medication. When you perform your initial assessment on this patient, you find her to be confused. Shifting has taken place, the first shift has gone, second shift has come, another nurse has taken over, and this nurse is now in charge of this 68 years lady. She has got hip fracture surgery, and when she visited this lady, she was confused. This is her case scenario. Now, what needs to be done? Step 1, what additional info do you need to gather prior to contacting the physician about this lady, about the disease? Additional information you might gather is vital signs and pulse oximetry. This is very normal. Whenever a patient gets admitted, we always take vital signs, blood pressure, pulse rate, all those things. Name, dose and timing of pain medication previously given. If it had been given earlier, what that medication, what was the prescription and how much dosage had been given so far. Any additional observation that you feel would be useful. You are a nurse, you have seen number of patients. So now whenever, it's not the first time that you are reporting about this particular case to the doctor. So you know what all, you use your initiative, use your knowledge. Vital signs, name, dose and timing of pain medication previously given, morphine, sulfate, this and that, all that medicine. Any additional observation that you feel would be helpful? Patient's respiration seems somewhat labored. Labored means it is little heavy. Breathing is heavy. This is the information you collected. This is the step 1. This information is very, very important. Now step 2, state concisely to the physician the problems that the patient is experiencing. Now after taking these medications, patient is undergoing certain conditions, certain situations are there. You already spoken, discuss with the patients. So give out these things to the doctor, nature of the problem, supporting information data, question or issues on which you need his or her help. Now you also know, you have also put in certain services, practice in medical field, you know what sort of medications, what sort of help to be given to the patient. So you suggest to the doctor, I personally feel that this is the way now, if we do something, this particular medicine can be given or this treatment, he might get some recovery. Role play, when you call the resident physician on duty, how would you state your concerns and question? Give a brief summary, not more than 60 seconds to the person sitting next to you. Have the person give you feedback on what was effective about your communication, what could you have been clearer. This particular thing you can do it amongst you people, friends. If any medical friend is there with you, you can try it out. Third step, actively listen to information communicated by the physician or healthcare worker. Active listening, I am just telling you, since last 2 weeks I am telling you, active listening is one of the most important parts of the communication. Why I am saying this, that you may pass the message, but that person is not very active, he has not listened properly, no action will be taken on that message. In medical field, it is very important that action should be taken immediately, instantly, otherwise it may affect adversely. The situation of the patient might deteriorate and we might not be in a position to save him. Actively listen to information communicated by the physician, healthcare worker. Listen to the plan of the care. Now the plan of the care has been given, this is the situation, they will work out this medication for so many days, 3 days, 5 days, 6 days, and we will keep him under observation. If any other treatment is to be given, physician will plan it out. Clarify areas which are unclear by asking appropriate questions. If you need further information on a particular area, find out by asking the questions to relevant people. Step 4, know how to tactfully use assertive communication when necessary. State your concern. Like in a patient-doctor's relationship, what is your concern? That you must give treatment as early as possible. If the treatment gets delayed, it might deteriorate the situation. So your concern is that the patient listen to your advice and starts the treatment as early as possible. This is your concern. In brief, your concern is patient's safety. That's your concern. Now state this, give this information and give certain data which supports your concern. Tell the patient, my dear friend, this is the situation, you are bleeding so much. We need to stop that bleeding. If required, we might need to give you some additional blood. You have to get admitted first for all these processes. This is your concern. Try very politely, tell him. Suggest a course of action. The concern must come back to the course of action. Just expressing concern or feelings is not enough. You are worrying about the situation, you are concerned. But what sort of steps need to be taken so that unnecessary delay does not take place in treatment? That course of action need to be given to the patient or the relatives, and they will generally accept it. Best option open, just give it out. Now, in this particular situation, we know that the patient is difficult, he is not trying to understand. Does not mean that it gives right to the doctor, does not mean that it gives a right to the doctor to be very, very assertive. He cannot yell or bullying. Yell means shout. If you don't do this, bloody well you will die. He cannot bully around. Well, listen to me. You are at a higher position medically, educated. But bullying, yelling will not work. Accusatory, you cannot accuse you don't understand at all, you know nothing, you just come from a village. Try and understand this. Such things will not make any headway. Being disrespectful, you can't become disrespectful. Whoever may be, poor or a villager or anybody, we got to be respectful in our communication. Yes, what is assertive communication is given here. Assertive communication means you are focused on patient. You are focused on patient's safety. That is your concern. You are worrying about it. You want to start the treatment as early as possible. The course of action has been already planned by you. Noting your perceptions, course of action, and persistently raising concern intended to move towards desired. Persistently raising concerns, you want to go to entire desire. I mean, so you have to persuade. You have to take some other measures. If the patient himself or herself is not understanding your words or concern, then you try, speak to certain relatives, other people, but you have to be at it so that finally patient understands and accepts the course of action. Why assertiveness does not work? Restate your concerns in another way. When still he doesn't understand, restate. Listen, my dear friends, if you do not start this treatment as early as possible, what will happen to you? You are an accidental case, lot of bleeding had already taken place. Immediately, if we do not admit you, and in next couple of hours, if you do not start treatment, then your life is in danger. And mind you, my dear friend, my dear patient, of course your life is in danger, but your whole family is dependent on you. Their life is also, it's a matter of concern for us. Restate your concern. It is not you, your safety is of course your botheration, but your safety is the botheration for your family also, because you are interconnected, interdependent. And when you get family into this, I am certain that the gentleman or gentle lady, whoever is there, will understand. Engage another healthcare worker, get another doctor, some higher doctor, get somebody and request him to speak to the patient. Yes, this is. Engage your supervisor, get somebody in the hierarchy. Engage another physician, but try and do not leave the problem at that particular end, because your main concern is patient safety. And by the way, it is the moral responsibility of a doctor. Effective communication, essential for teamwork, essential for long-term career satisfaction as a doctor, as a professional, anywhere for that matter, essential for success at any stage, whether in a family, school or at workplace, in a hospital. And most important, when we are talking about palliative care, patient safety remains at the top level in our mind. That is all about communication between health professionals, and we discuss about assertive requirement of assertion, assertive authority, by health professional, how it is to be given out so that no harm happens to the patient. Thank you.